Today, we're going to touch upon the combination of surgical procedures. First, is it possible? This is a question that we get asked a lot, and it's definitely possible to combine surgical procedures in one surgical session, but it all depends on how comfortable the surgeon is doing this. Now, is it safe? Which is probably the main question we have to ask. And it's definitely safe when you're talking with somebody with experience in combining medical procedures. It all depends on your plastic surgeon, but it's very important that you follow their recommendations. Now, what are the disadvantages or advantages of combining medical procedures? So, I think there are many advantages of combining the surgical procedures, as you can have many things done in one operative session and requires only one anesthesia and requires only one recovery. So these are, significant advantages, and there is also an advantage in cost, because once you combine several surgical procedures, then it becomes less costly in one session. Now, what are the disadvantages of combining medical procedures? Perhaps the main disadvantage that you have if performed by a well-trained professional with sufficient experience is that the recovery time is going to be a little longer, because it can range from 1 week, combining, for example, a breast lift and an augmentation, to several weeks, talking about 3 or 4 weeks when you're combining a whole body makeover. Now, which procedures are commonly combined? And let's start from head to toes. And I think we can talk about the head and neck procedures. Head and neck procedures are usually combined because you can do, for example, eyelid surgery, upper and lower eyelid for the periorbital rejuvenation, the brow lift. Those procedures are usually done in the same session. You can also combine procedures for facelift and neck lift, which is very common, and all those procedures can be combined, including with rhinoplasty and so forth. Now, when we're talking about the body, it's very common to combine, for example, for the breast, a breast lift and an augmentation. Some centers will do it in 2 separate sessions. They will do the lift first and then they will put an implant. My preference is to combine it because it's one surgical recovery and you have the procedure and the results done at once. Now, there is a very common part that you will split the upper body and the lower body, combining, for example, a brachioplasty or arm lift along with a breast lift or plus-minus augmentation. And then you can do the lower body, combining, for example, a BBL with a tummy tuck and perhaps your thighs. In my practice, we have the ability of combining multiple of these procedures, including, for example, all the procedures in your body, meaning the arms, the breast, the circumferential body, the butt, and the thighs. And we can do this because it's a team approach. In many occasions, we operate with more than one surgeon. We do our 2 surgeons, which reduces significantly the operative times. It's very important that both surgeons have a lot of experience, and it's very important that you keep the safety parameters in place. Time is one of them. You don't want to do surgeries that take longer than 6 or 7 hours. So it's very important that with your experience, you combine the procedures that you can safely perform in those 6 hours. We are able to perform things like arm lift, breast lift, circumferential body lift, buttock lift, an augmentation, fat transfer, and thigh lift within those 6 hours because we use a team approach. There are many persons taking care of you at the same time. There are 2 surgeons involved. There are techs, there are anesthesiologists, there are nurses. And we are also very involved with the post-operative care, which is very important. Once you combine these multiple surgical procedures, it's very common that you will need, for example, a blood transfusion or at least a close follow-up. We take every measure to avoid for you to have a blood transfusion, but in many occasions it is necessary. And we use things like Cell Saver, which will give you back your blood that you lose during surgery. We take measures and using the newest technologies available to prevent anything that can go wrong. And we take care of your recovery in many cases, depending on the amount of procedures combined, but you will spend at least 1 night in the hospital, sometimes 2, and then we follow you along the first couple of weeks. So when the time comes and you're considering having multiple surgical procedures, you can visit my website, magicsurgeon.com. You will see a lot more information there. Come and talk to me in a consultation. We can discuss your particular case. Remember that there are not very many surgeons in the world that can perform these multiple combinations of procedures, and I'll be happy to discuss the best options for you. If you like this video, please give it a thumbs up, look it up, and then share it with your friends. And I will see you back in the next video. And always remember, believe in magic.